Hi everyone, I'm Hartford Healthcare's Tina Varona coming to you live from Hartford Hospital. Well, another exciting day on tap. For the second week in a row, we are making history here at Hartford Hospital. I am so happy and thrilled to be joined by Bimal Patel. He's the president of Hartford Hospital and also a pharmacist. Bimal, good afternoon.
Hi, good afternoon or good morning.
Almost afternoon, yes. Thank you for joining us. Bimal, this is, as I said, a historic day. What are your feelings today? Here we are the next Monday after the Pfizer-BioNTech COVID-19 vaccine. Now we have Moderna. What are your feelings?
I'm glad you mentioned that I was a pharmacist before I became the president of the hospital. In my 15 years working as a scientist or scientific person in the frontline clinical capacities, I couldn't be more excited and thankful for the rapid speed to which we have achieved and where we are here today with the vaccination. So that's number one. Number two, it is absolutely important that we prioritize and utilize the vaccines for the folks who are in the front line. So obviously we are following the right guidance. And I'm thankful that our frontline staff has much needed protection above and beyond the PPE protections that we're able to provide via vaccination.
I was going to ask you, because you are in an incredibly unique position. Not only are you the president of Hartford Hospital, but you're a pharmacist. So talk to us about how those roles merge and how you roll out this vaccine in terms of who gets it first. So from the administrative part as well as your pharmacological background.
Sure. So it's a complex distribution channels, from the storage facility to stand up appropriately to logistics of registering people, prioritizing who will get the vaccination, also making sure that we don't vaccinate one group of people and potentially put a risk of side effects and have the workforce out. So we, even among the prioritization, we have scheduled in a way that our workforce is ready, safe, healthy to take care of our patients as well. So there are a variety of different screenings that we apply in order to do the scheduling for our frontline staff. I'm proud to say that we have last 3 or 4 days that we have been utilizing Pfizer vaccine, and starting today we'll be utilizing Moderna vaccines. We are actually maximizing all the slots available to us here on the campus. Our teams of nurses, pharmacists, and others are really making an enormous difference by working multiple shifts to vaccinate individuals. And our rate of vaccination, being a large tertiary medical center, we have more than 7,000 people work here. So it will take at least a few more weeks to stabilize and vaccinate all of those who need to be vaccinated. And after that, we will prioritize other healthcare providers who are in the administrative roles otherwise to get vaccinated. But first and foremost is the frontline staff, nurses, physicians, respiratory therapists, environmental service folks, security staff, whoever works in the front line caring for our patients.
Bimal, as you look on last week with the Pfizer vaccine being administered right here at Hartford Hospital and then today, talk to us about your thoughts as president to see, and you've been through this for the last 9 months with the healthcare workers on the front lines, and to see this day come, this momentous day. Talk to us a little bit about how you're feeling.
Yes, so I've seen over the last 9+ months trepidations, fears in the faces of people providing care. In the early days in particular, when we didn't have complete science of the disease available to us or the care plans and the pathways. Subsequently, we have moved on to a much better spot today. So there is a spring as our healthcare workers come to work in their walk because of the fact that we have better awareness and knowledge about the different therapies available, availability of vaccinations, access to appropriate PPE, better clinical care protocols, and subsequently better outcome for our patients, the most importantly. And those are helping build the morale of the staff. So I am watching the staff every day for the last 9 months, and what I see today is much better than what I saw in early March and April timeframe, where our staff are more hopeful. While they are working harder than before, they are more hopeful today for our community and for our patients.
And Bimal, it's so nice to see that these frontline workers and all workers from all colleagues across the Hartford Hospital and across Hartford Healthcare really stepping up and gladly rolling up their sleeves to take this vaccine. There is some trepidation out in the community. Some people are fearful, but as a pharmacist, knowing what you know, and as a leader of Hartford Hospital and seeing what you've seen in the last 2 weeks, what do you want to tell viewers out there who might be a little reticent about getting the vaccine?
Absolutely. So the normal process of vaccination and the type of the development of vaccination is fundamentally different this time around. The mRNA-based vaccination not only shows higher efficacy in terms of how it's impactful, but in terms of its safety profile, over about 40,000 for the Pfizer vaccine that were tested, and now that we have about more than a week worth of data available to us, it seems reasonably safe, and no other extraordinary situation has been created where people's safety has been jeopardized. So it is within the safety guidance and limits of what we accept in the clinical practices. And as you can see, that we have physicians, nurses, and all the folks who work in the front line are lining up to obtain the vaccine because of both efficacy and safety reasons. So I think my opinion at this point is that we should feel comfortable obtaining the vaccine. Personally, I would take the vaccine anytime. As I said earlier, we are prioritizing our frontline staff, and so once those requirements are met for us and they are safely vaccinated, I'll be in line getting my vaccine as well.
Bimal Patel, thank you so much. I think, for the first time, we finally have a defense mechanism against this deadly virus. So thank you for your leadership, and thank you for your pharmacological background. It really, did you ever think that you would marry those two together at some point in your career?
Well, I never thought, but it is good to have, and I think it makes a job much more fun and much more understandable from the variety of different perspectives. And I'm more grateful and thankful for opportunities I have to serve 7,000 individuals who work at this organization. It's such a pleasure and honor.
Well, not only do you bring a unique perspective, but you bring a lot of heart to it as well. So we appreciate your leadership. Bimal Patel, thank you.
Thank you, Tina.
And of course, as always, thank you out there for watching. We're going to have much more on Facebook, so stay tuned. But for now, be well.